Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Some tremendous questions, some brand new ones. I always enjoy getting new questions. Dr. Bob, what supplements do you suggest for an enlarged liver? Well, first you want to back off on fruit, alcohol, prescription medications. Those will always enlarge your liver, but milk thistle is very good. That's what we use in our practice. One that's a blend of milk thistle. Dr. Bob, I had my thyroid removed. I take levothyroxine. My eyebrows are thin on the outer edges. What can I use to help the problem? In our practice, we follow the numbers because, see, levothyroxine is only T4 and it has to be converted to T3. Stress stops that from occurring. So does compromised liver function, low zinc, high copper, low progesterone. Excellent question. You may consider contacting us because you have poor conversion of T4 to T3, which probably 50% of the individuals that I see around the world have that exact same phenomena. The medical community calls it hypothyroid number 2. Dr. Bob, I have a question about my adrenal glands. You had a CAT scan done. You had a problem with your stomach. The doctors found coarse calcification of the adrenals above my kidney, and he wanted to know what to do to avoid further damage. Well, in the most recent book that I released, Dr. Bob's Guide to Prevent Surgery, I have a chapter in there on how to prevent cataracts. The same physiology that impacts and causes cataracts can cause calcification elsewhere in the body. You may consider having your calcium and phosphorus ratios, your serum calcium phosphorus ratios, checked. We do this in our practice with an OptiChem profile, which we can send you a requisition anywhere in the world. Usually it's 10 parts calcium, 4 parts phosphorus. If it's higher than that, you may have too much calcium in your body. Dr. Bob, I've had arthritis for a couple decades. You've had it under control. You're doing the anti-inflammatory diet. Wanted to know if I could recommend anything. What I have found when it comes to arthritis, most arthritis challenges are a liver problem. The liver has so much to do with so many areas in your body. You got to clean that liver up. You know, I wrote a book on detoxification you may consider obtaining, but my recent book on preventing surgery, we have a lot of information in there about liver. This is a very detailed question. The individual had an 18-month-old child that their adenoids and the tonsils have been enlarged. I know that you've had snoring problems, multiple ear problems. You've had some chiropractic care. There's a lot of fluid in the ears. So, something is going on in the child's diet that's causing inflammation. One man's passion is another man's poison. So, you know, we have a tool in our practice where we can do a food stressor electronically. And I've had a lady had a chronic bladder infection. And when we checked her out, her real issue was coconut oil. Coconut oil is not bad, but coconut oil was an issue for her. So your child more than likely has some type of sensitivity to one of her favorite foods. Peanut butter, dairy, corn are probably the most common ones. Dr. Bob, I'm looking for a natural remedy for my 19-year-old child. He plays competitive hockey and not sure if he had an old hockey injury, but the ultrasound said he had a varicocele. It's in a mild stage. You wanted to know what to do about it. Well, you know, I'm not really familiar with how to help and improve a varicocele, but I can tell you from my experience, we've had a lot of genital issues when it came to men, and I know if the sacroiliac joint, which is the lower joint in the spine, is out of alignment, it could definitely impact the nerves that go to that part of the body. But I'm not going to be so silly and think that, yes, it could have been caused by trauma. You want to get more than one opinion on that, by the way. Dr. Bob, what do you think about stem cell therapy? Well, I want you to know that I'm not real familiar with it, but I do know that when I've had facials done in the past, the individuals that was working on my face always talked about stem cell from some of the plants and other herbs that she used that help rejuvenate and improve function in the skin and the tissue. So that's probably the closest that I know is plant-based stem cell therapy for facials. Last question. Dr. Bob, your mom has been recently diagnosed with low ejection fraction, and you put the in parentheses EF of the heart, 25 to 35%. Any idea how to boost the EF in a safe and drugless manner? Well, very simply put, hawthorn berry is the herb of choice for most heart issues. But very interesting, in our practice, we have a tool called the acoustic cardiogram, which is an electronic stethoscope. And this assesses heart sounds, and it creates a graph. And then we supplement accordingly, because oftentimes there are nutrients. Gluten could stop nutrients from being absorbed, lack of B vitamins. We see French fries, so you have to drill down to digestion, improve the digestion, get her off of gluten for sure. Hawthorn berry might be an answer. Tremendous questions today. I'm Dr. Bob DeMaria.